149 physicians, 18 locations in Albuquerque and Rio Rancho. ABQ Health Partners is a physician-led multi-specialty medical group leading efforts to bring total care and patient-centered care to our community.
And this week we headed out to get more information on how ABQ Health Partners can help you and your whole family no matter their age. Take a look.
Hey guys, we are here at ABQ Health Partners today, home of Total Care, and we're finding more information out about how they are keeping New Mexico healthy. Come on. All right, guys, so we're here with Dr. Lance Wilson with ABQ Health Partners today, and we're talking about care management. Of course, you guys are presenting Total Care, which is a great opportunity for patients to really have exactly what the name says, Total Care. But what specifically is care management? How does that fit into the program?
Yeah, so care management is part of our Total Care program, and it has a couple different parts. One is disease management, which we'll talk a little bit about. The other is case management, which we'll talk a little bit about. But care management really helps us with our Total Care program by allowing us to do more things for a patient than a typical medical group could do. The care management department is made up of nurses and care management assistants, also some physicians that really can help patients with questions they have about their care, medication questions. We help them transition when they get out of the hospital into the home environment, or if they need to go to a skilled nursing facility. We help them with specific disease processes. If they're struggling with their asthma or things like that, we can help them with those disease processes as well.
Okay, so now you said it breaks down into a couple of different things. We got case management and then disease management. So let's first talk about case management. How does that work?
So case management is for a couple of different types of patients. One would be if you didn't fit nicely into a specific disease program. We'll talk about those in a minute. If you have multiple diseases that may be interacting with each other, or really the patients that just need some additional help, if they need help with transportation, or they need home services, or they need a contact person to be able to ask questions, our care management or case management nurses are available to them.
Okay, and then the disease management, that's if we're focusing on one specific disease that has a specific treatment.
Right, so we have several disease management programs, one around asthma, one around COPD or emphysema, one around congestive heart failure, one around diabetes. And those really focus specifically on those diseases. So if that's your main medical problem is you have one of those disease processes, then our nurses are really expert in those areas. They can help you with your medications, help communicate with your doctors, help with appointments and things like that. And so they really focus on those individual diseases, where case management really is a little bit broader and helps people if they're not fitting into one of those nice little disease process programs.
Gotcha. Okay. So then, even expanding a little further from the case management, complex health situations. So let's talk about that and how you treat those situations.
Yeah. So there's within case management, we have sort of what we would call general or routine case management, but we also have complex case management, and that's really for those really small number of patients that really have a lot of things going on. They have a lot of visits. They're on a lot of medications. They're seeing a lot of specialists. They have a lot of disease processes, and the nurses really help those patients coordinate their care. As we talked about earlier, communication and coordination are really important, and the case management nurses really can act as that go-between between the patient and their primary care offices and help coordinate all that care. Okay.
So when should a patient consider enrolling in one of the care management, be it the complex health care or disease management?
So a patient that's in the Medicare Advantage plan and that sees one of our primary care providers, if they have one of these diseases or if they have complex health problems or any concerns really about their care and are having trouble with accessing care, anything like that, they can certainly get in touch with us and see if they qualify for one of the care management programs.
Gotcha. And what's the best way for them to contact you?
So they can call the main number, which is 262-7000. They can also get on our website at www.abqhp.com. And there's sections on the website about care management.
So for more information on ABQ Health Partners, head over to CASA.com and click on the Style tab.